You might comment on it or you might not. And as you listen to the patient's account of how they did or what they did as part of their practice assignment, you're first of all listening to answer the question, does this patient understand what the skill is? Did they get it? Whether they used it correctly or not. And are you getting enough behavioral specifics about their use of the skill in order to comment on what worked or what didn't work, and in order to coach trying something different? Rather than focusing on the patient's motivation, where you get into kind of a sticky muck, focus on the performance. Like, what did they do? Did it work? How did it work? Why didn't it work? Could it work better if you did it a certain way? And provide feedback that could strengthen the performance of using that skill. Okay? So just really very coaching, very much specific, performance-oriented coaching. Not getting into big discussions, because this is going to be something like a 6-minute conversation. Next slide, reviewing homework, slide number 2. When reviewing the patient skills practice about what they did on last week's assignment, you can also use that time to weave in feedback about other skills that they used as you heard about it, things they might not have thought about. So it reminds them they're starting to incorporate the use of other skills because these skills kind of all weave together in different places. And highlight other skills that might have been used to help during that segment. So you're focusing on one skill that was taught, but actually you're using the opportunity to comment on other skills that would be relevant. Reinforce skills use in general. You're encouraging effective selection among the different options of skills. You try to stay on target and not get into lengthy tangents. The time goes by very quickly. You want to provide positive feedback around any critical feedback, validation and support and reinforcement of what they did well, and then a comment constructively about something they might have been able to do better. If the patient is sensitive to feedback, I'm suggesting don't remove the cues. In other words, don't hesitate to give feedback. Don't dance around giving feedback. Instead, if it's reasonable feedback, give the feedback and then help the person come to grips with it. So just a fundamental difference in orientation. You don't want to start to treat the patient as fragile, because that tendency will usually grow. And reinforce praise and encouragement among patients. So if another patient comments in a reinforcing way about what somebody did, you might want to reinforce that they did that. Review homework number 3, the third slide. Keep track of the time. Each patient should get about the same amount of time as everyone else. Doesn't have to be rigid, but you want to keep it fair. So even if a patient didn't do the homework, you're going to do something with them that I'll get to, that use their time to take a look at having not done the homework. So go first to patients who did the homework, like I said before, to reinforce that. They become the models of functional behavior that you're interested in, and reinforce performance and effort, not by scolding anybody, but by reinforcing the ones who did it. Then move on to those who didn't do their homework. So the way I do this is I go around the group and say, how did your homework go? Well, I didn't do it. Okay, we'll get back to you. And I'll do that each time until I get to people who did the homework, do them first, then come back to the ones who didn't. What do I do with the ones who didn't do homework? There's different options. One is possibly do a mini behavioral chain analysis of the non-compliance. And usually I start that by saying, okay, well, let me ask you this. When you left the group last week, did you know what the assignment was? Did you have it written down? Did you take it with you? Did you know what it was? If you did you intend to do it when you left? Okay, maybe you intended to do it. And then what happened during the week when the possibility came up of doing it? What got in the way of doing it? So you're kind of looking chronologically. How did you go from last group into the time that you might have done your homework and then you didn't do the homework? And you find different things from different people. People say, well, I didn't want to do it, or it didn't make sense to me, or I had a week of lots of crises, so I couldn't get to it. I was really tired this week. I resented that assignment. All kinds of things can get in the way. You might find actually when you go through this that they actually did the homework, but they forgot they did it. Or they did the homework, but they didn't know they did it. They did it, and they did something that could be construed as the homework. And you might want to give them credit for that and then problem solve the barriers to doing the homework. I mean, once you start to hear what the problems are or how it went. The next slide speaks to what do you do during the break? Because now you've gone around and you've done the homework review. Like I said, it's typically going to be 6 to 7 minutes a patient. I don't think I've said, so I want to say this now. How many people should be in the group? Who should be in the group? I realize I don't have a slide to that effect. How many should be in the group? Well, here's the limiting factor is the homework. You could teach new skills to 15 or 20 people, but it doesn't require a lot of interaction one-on-one with every single person. But when you're reviewing homework, you really have to do it one at a time and give each person the chance to review homework and you the chance to work with them or to work on non-compliance. So let's say you have a group that's 2 hours long and you're going to spend 50 minutes. Let's say you're spending 10 minutes between mindfulness and a discussion and getting started. Now you've got maybe 50 minutes that you're going to spend on reviewing homework, and then 10 minutes of a break, and then 50 minutes on teaching new skills. So if you have 50 minutes, I want people to have at least 6 minutes to review homework. Up to 9 is nice. And so what would that be? If you had 50 minutes, you divide that by 7, that would be 7 minutes a person for 7 people. So you could do a group of 7 very nicely if you have that time frame. If you have a reduced time frame, you still want to make sure that your homework review includes 6 or 7 minutes per person. So let's say you have a group that's an hour and a quarter because of insurance won't cover any more than that. You might do homework in 30 minutes, do a brief break, and then whatever's left for teaching new skills. 30 minutes, that'd be 6 people could each get 5 minutes, 5 people could get 6 minutes. So of course these things are calculations you have to make the group work and to make it affordable, but that's the idea. Who should be in the group together? Can you put different categories of people, so to speak? I mean, as if we're in categories, which is only conceptual. Like, here's my take on that. There's a lot of ways to decide who can enter the group, and it's different in different clinical settings. If you're a research setting, you have to define by research criteria who's in your group. Most places are not like that. So let's say a typical private practice or clinic group. You might take people of different diagnoses, but they have in common emotional dysregulation. They have in common some sort of behavioral problem. Maybe it's even interpersonal and not something else. And I can take people, some people who are self-harming, some people who are suicidal, some people who have eating disorders, some people who have substance use disorders. I can put them in the same group. The thing that's hard to put in the same group is people who are different, significantly different levels of cognitive functioning, because you have to slow down the group and make it more concrete and visual for some people, and that could slow down people who could go more quickly. So that's the harder mix of dramatically different levels of cognitive functioning. Okay. So during the break, what do you do during the break? Well, the homework review, which comes first in the group, can be stressful. So a break is a good idea. People can use the bathroom, people could get something to eat, something to drink, and they can hang out, they can defuse, they can be alone, they can be together. The co-leader can hang out with them to be supportive and just to hear what's going on. So usually during a break, it's sort of low-key, casual, relaxing, and people get a chance a little bit to recover from what might have been a stressful homework review. The primary leader during the break is kind of getting ready to teach the new skills, going over the teaching plan, getting visuals ready if you're putting things up on a whiteboard or blackboard or a flip chart or something like that, and making sure that you've got everything in order so that you're kind of ready to go when people come back from break. Now it's in the next slide, and the next thing you do in group is to teach new skills. So after break, you want to start by getting the group's attention about the new skills you're going to teach. Don't just turn to the handouts and have them turn to handouts. That can be, you can just lose a lot of attention at that point. And don't just lecture in a way like I'm doing right now, in a way that just promotes passivity in the group. You want to engage them with something. That could be a story you tell them, it could be a video you show, like from YouTube, it could be some sort of visual aid that you show, or it might be just getting them engaged in an engaging discussion about heading towards teaching the skill you're about to teach. And then you want to put the new skill in context of prior skills. I mean, I'll typically start by saying, remember, we're in the middle of distress tolerance. And now we've gone over the skills for crisis survival. And now we're about to shift to this other major category of skills, which is so important that I want to tell you a little story. And it might be leading into radical acceptance or something like that. And I want to create a rationale and a hook for learning the new skills. Now I want to sell the skills as I'm teaching them with data, with examples from my own life, with self-disclosure, with typically what helps people about these skills, and really try to get it across. If you don't get people's attention, if you don't get people engaged, if you don't get people willing to listen, of course you never get them to try the skills. Sometimes you might just start with a role play or start with a practice of some kind. And when I've gone over the different skills modules, I've given some examples of those when I was teaching the skills modules. And encourage questions from people about the content of the skills. Get into debates and discussions. Ask if people have had these, have used these skills and how they've worked and why haven't they worked. Now, the next slide says, while teaching new skills, what do you do while you're teaching? So let's say you have a good plan for teaching. You engage people in teaching. Now, you weave in self-management skills. We don't teach a module on self-management. But self-management means, how do you get yourself to do hard things? How do you get yourself to do the skills? How do you get yourself to get up in the morning? How do you get yourself to get to work, to come to skills group, etc.? That's all self-management. And they're like executive functioning skills. So while you're going through the teaching of skills, whenever possible, weave in ideas for how to get yourself to do things, how to reinforce yourself for doing things, how to prompt yourself to do things, how to get yourself in a situation where you're more likely to do things. So all these strategies for getting yourself on board. Next, always be connecting the skills you're teaching to the client's lives. So obviously, if you know the clients better, it's easier to do that. You can say, oh, Bill, you remember how you were talking about what goes on at home? This skill might be really helpful for you. So anytime you can just link the skills you're teaching with the people's lives, so that it sort of programs them to see how it's going to work in their own life. And try to make it specific or explicit about how the particular skill would work in their particular behavioral patterns. Again, the particularity that grows from getting to know the group. The more you can name people, name what people are likely to be able to use, where they can use it in their lives, how they can use it, how it fits with other behavioral patterns that you know about them, the more it'll get their attention. Try to be creative in how you teach the skills, use everything you got, but at the same time, try to stick to the manual. There is a certain intentionality of these skills, where to use them, how to use them, what exactly are they. They're written up in detail in the manual. And so try to stick to that.